COVID-19 cases are again going up and have doubled in the past month in Texas. But what to do if you catch the virus or get exposed is less of a line and more of a tree.
Go home, isolate yourself, don't get anyone else sick.
Those under 60 with just a cough, sore throat, or fatigue should stay home.
Drink lots of water. You're going to need rest. Get the rest. Don't fight that. And then use over-the-counter cough medicine, anti-inflammatory medication, Advil, Aleve, acetaminophen if you like.
But see a doctor if you pass out, have confusion, or trouble breathing.
Like you're sitting there watching TV and you're like, oh my gosh, like I have to take some deep breaths or I don't feel very good. Trouble breathing like that, get yourself to a doctor.
Over 60 or with health conditions, talk to your doctor to get help with antibody treatments or antiviral pills like Paxlovid. If you've been exposed, test if you feel sick or 4 to 7 days after the contact. Tests are now free from USPS or at a pharmacy with insurance.
If in doubt, just get a test. They're pretty darn good, particularly if you do them serially. But we want to stop the spread of this virus so we can finally go back to life as usual.
Tests are good, vaccines are better, and important as immunity from Omicron surge fades.
Well, people who get vaccinated also get sick. Well, yeah, that's true, but they have a whole lot less chance of dying. So that's a good thing, right? And the chances of you getting sick are much, much, much lower.
Dr. David Winter at Baylor Scott and White says he's masking on planes and in crowds.
They are going to continue to mutate. The next one could be a bad one. So that's what I worry about.
COVID is both preventable and treatable if you follow the advice of doctors dealing with it more than 2 years later. In Dallas, I'm William Joy.